I had a very close friend several years ago who was diagnosed with breast cancer. She went through a series of very difficult tests and ended up getting a double mastectomy. Along the way, I helped her with doctor appointments and insurance and paperwork. It was a very long journey for both of us. She ended up passing away in September. And in December, I received a call and asking about doing this work. And I just always felt that that was my friend, like saying, hello, go on, you can do this because you helped me and you would be good at this. So I took the job as a community health worker based on that. The Pathway Hub model helps me to stay organized and focused on the task at hand. It keeps me on track. Some of the questions that I ask the clients, I might not normally ask if they weren't in some of the pathways. I just feel that it's a great, great program, and it's just proven to be very successful for me. There are so many, I could tell you hundreds. It's hard to focus on one, but I do have one in mind that is a really good story. This gentleman was at a shelter, and when I met him, he had no Medicaid, no SNAP. He had come off the streets into the shelter, and I was able to connect him to Medicaid and SNAP on several visits. He ended up opening up to me and telling me that he was assaulted the year before, and he had some ear, nose, and throat issues, severe enough that he was having a difficult time. So I suggested to him that we get to an ENT doctor, which he agreed to do. And after many visits, he needed surgery. Set up all the surgery, did the transportation, which was extremely challenging, only because it was the dead of winter and the transportation was having a difficult time with this particular managed care plan, but we did end up working it out. At one point, it was 7 o'clock at night on after his like 5 o'clock appointment ended, and he was still waiting for his ride. I ended up getting him an Uber because he had no way to get back to the shelter. So it was a good story. He went through a program at the shelter and got housing, which he was extremely excited about. He couldn't wait to call and tell me. We helped to furnish his apartment through Humble Hearts. They deliver the furniture, they call, they set everything up. He ended up getting a job at a nursery, which he couldn't wait to call and tell me. He's working part-time at a nursery. And what struck me about this guy was one day he called me and he said, hi, Janice. And I said, hi, how are you? How can I help you? And he said, you don't need to help me today. And I said, okay. And he said, every time I call you, I am always asking you to help me. And this time I just want to call and say hi and see how you're doing. And I was very taken back by that. I said, that was the nicest thing. You made my day. And he's still doing well. We stay in touch probably every month. And he's very happy to be living out of the shelter, to be living on in his own apartment, and to be able to make some money that, he can use as he pleases. I'm going to be real honest. I don't need a whole lot of help building relationships with clients. I just connect with them. I don't know what it is. There's something, since I was very young, I was always for the underdog. And I just, the minute I meet someone, I just am I warm up to them. And in 8 years, I've had one client stand up and get mad at me and walk away. And that was about a month ago. And he had me in tears. So the hub keeps me connected and on task. It helps me because I have goals set, knowing what pathways I'm going towards, and there's a format to follow. And I think it's very helpful